All right, let's dive right in. Today, we're going to unpack one of the biggest, most ambitious goals humanity has ever set for itself, making sure every single person on this planet can live a healthy life. This is the story of Sustainable Development Goal 3.
But before we get into all the policies and numbers, let's just start with a really big question. When we say a healthy life for everyone, what does that actually look like? I mean, what are we really fighting for? It seems simple, but the answer is anything but.
Well, the official answer is this: Sustainable Development Goal 3, or SDG3 for short. Its mission is to ensure healthy lives and promote well-being for all at all ages. But here's what makes this so powerful. It reframes health not just as a nice goal to have, but as a fundamental human right. And that right is totally essential for any kind of real sustainable progress.
So, you can think of SDG3 as a global promise, a blueprint for building a healthier world. But what's actually in that blueprint? Let's take a closer look.
The scope here is just massive. I mean, we're talking about everything from making childbirth safer for mothers and babies to finally ending huge epidemics like AIDS, tuberculosis, and malaria. But it also goes way beyond that, to fighting chronic diseases, promoting mental health, and the big one, achieving universal health coverage so that nobody has to go bankrupt just to get the care they need. It really is the whole shebang.
So that's the dream, right? That's the promise. But now we have to face the reality. And honestly, it's a pretty harsh reality check. This incredible promise we've made is in some serious trouble.
Take a good look at this number. 16%. That's the percentage of all the Sustainable Development Goals that are currently on track to be met by 2030. That means the vast majority, including a whole lot of the health targets we just talked about, are way off schedule.
And look, this isn't just about numbers on a spreadsheet. This has devastating real-world consequences. This quote says it all. For the first time in 15 years, deaths from tuberculosis, a disease we know how to treat, actually went up. It shows we're not just standing still. In some cases, we're actually losing ground.
And a huge reason for this reversal? You guessed it, the COVID-19 pandemic. Before 2020, things were moving along, slowly for sure, but we were making progress. The pandemic just changed everything. It pushed healthcare systems around the world to their breaking point, it messed up essential services like childhood vaccinations, and it basically threw a giant wrench in the world's progress toward universal health coverage.
Okay, so to really get our heads around this huge challenge, let's zoom in on two critical battlegrounds where this fight for global health is playing out right now. Non-communicable diseases, what we call NCDs, and universal health coverage, or UHC.
It's kind of like two sides of the same coin. On one side, you have the problem, NCDs. Think cancer, heart disease, diabetes. They're not contagious, and they're often preventable, but they are by far the world's biggest killers. And on the other side, you have the goal, the structural solution, UHC. That's the big idea that everyone, no matter who they are or where they live, should be able to get the health care they need without it costing them everything they have.
And the scale of this problem is just staggering. I mean, look at this. Together, NCDs are responsible for over 70% of all deaths around the world. Heart and circulatory diseases alone are the biggest killer by a huge margin. So these aren't some rare conditions, they are the primary health challenge facing the entire world.
So how do we even begin to fight back? Well, it's got to be an all-out effort. It has to start with prevention, tackling the root causes like smoking, pollution, and unhealthy diets. It means we have to invest in early detection, helping people catch problems before they get serious. And, critically, it means finally taking mental health seriously and making sure that once someone is diagnosed, they can get affordable, consistent care for the long haul.
Now, this next part is maybe the most important takeaway of this whole thing. Tackling these massive health issues, it's not just a job for doctors and scientists. Good health is everyone's business, because it turns out it's deeply connected to, well, everything else.
There's this really powerful idea called the health in all policies approach. And what it means basically is that you can't fix health in a vacuum. You can't just build hospitals and hope for the best. Every single policy, from the economy to the environment, has an impact on our health.
So, if you really stop and think about it, what does good health truly require? It's built on a foundation that's so much bigger than just medicine.
For one, it requires an end to poverty, because poverty is one of the biggest drivers of poor health. You can't be healthy if you're struggling every day just to survive.
It absolutely requires a good education. When people have knowledge, they are empowered to make healthier choices for themselves and for their kids. And of course, it requires the absolute basics, right? Like clean water and sanitation. And this is the big aha moment. You simply cannot have a healthy population without a healthy society. All these goals are connected. Achieving Goal 3 is impossible without making progress on all the others.
So, where do we go from here? What's the game plan to get back on track? Well, it's pretty clear. We need more money for health, period, from local clinics to global initiatives. We have to invest in our health workforce, the doctors, the nurses, the community workers who are on the front lines every single day. We need to build everything on a rock-solid foundation of primary healthcare, drive new innovations, and, most of all, we need to work together. This kind of collaboration isn't optional. It's the only way any of this works.
And when you boil it all down, it really comes to this. Achieving global health for everyone isn't some far-off dream that might happen one day. It's a choice. It's a choice we make every day with our priorities, with our investments, and with our willingness to see each other's well-being as our own. So the real question for all of us is, what future are we going to choose to build?